who's a psychiatrist. And also the fact that Dr. Shivani Bansal has already told us that people are referred to physicians when probably they need a psychiatric care, neuropsychological care. And therefore there might be delay. There might be delay because they do not agree to the advice of the doctor. They are not very sure if they want to go, and there's a lot of stigma attached. So my question to Dr. Shivani Dudha is how mental illness and the stigma is associated. Is there a delay that you see? Is there a lasting impact that it creates? So if I am somebody who is suffering from a mental illness, but I only come to you after, like, let's say 12 months of being in this, how does this affect the treatment process? How do you try to tell the patient and the family about the whole situation, how it affects the treatment?
Thank you so much, Shachi, for putting that question across, and a very happy World Mental Health Day to everybody. Thank you, Sunny, for organizing this roundtable discussion. It's extremely useful and relevant talks by all the panelists so far this morning. It's actually quite uncommon to be having such a wide range of issues being discussed under one umbrella. So I think I would just like to begin by saying that this is a very fantastic effort that you have undertaken. You've asked me today the question about association between mental illness and stigma, and I think the two are very much connected to each other. This is a very real and prevalent issue in the field of psychiatry, more than any other medical specialty that I have ever seen or known. So what is stigma? Stigma is basically the fear of the unknown, having preformed backward notions, having a lack of understanding or inaccurate understanding about a mental illness. And this often leads to people being stereotyped, ostracized, and made to feel like an outcast, not a member of the society. Stigma, along with prejudice and discrimination, leads to grave harm, both directly and also indirectly, to those people who are suffering with a mental illness, regardless of whether they have a formal diagnosis or not. And if they have a formal diagnosis, stigma leads to hampering the recovery process of those people who are undergoing treatment. Just to quote something formally, there was a study done by Corrigan and colleagues that identified 3 types of stigma. So 3 types of stigma are public, self-stigma, and institutional stigma. When it comes to public stigma, countless studies have been done across the world which show that unfortunately, many people still have a very negative view on those who suffer with mental illness. This often leads to marginalization and stereotyping of people. Various media outlets that portray those suffering with mental illness have played, unfortunately, a very huge role in driving the negative connotations and keeping them alive, especially in a country like India. I think all of you might remember this movie called Crazy 4, where there were 4 people suffering with a mental illness who were institutionalized, and they were portrayed in this extremely horrific light just to sell the movie. And it led to people having such horrific views of people suffering with mental illness. And it ultimately leads to people being discouraged from seeking help for their symptoms. And it also leads to other people judging negatively those people who suffer with mental illness. Even in Hollywood, the famous movie Joker that was released in 2019 portrayed the lead protagonist seeing a psychiatrist in a dark, dingy, run-down clinic, which looked nothing like a hospital. And it was shown that he became extremely violent when his illness was left untreated. Now, this is completely untrue because all the studies that have been done so far actually show that people who are suffering with a mental illness are far more likely to be victims of violence rather than the perpetrators of violence. Coming to the specific illness that he had, which is psychosis, anytime in their life, 1 out of 100 people are susceptible to having symptoms of psychosis in their life. So this movie was such a grave misrepresentation of a very serious mental illness like psychosis. Then, taking my own example and coming to public stigma, what I would like to share is that when I was diagnosed with severe depression back in medical college, I was looked down upon as a doctor in the making, and I was told that I wasn't really cut out for this profession. An attempt to seek help from psychiatrists was met with extreme judgment, and I was actually frowned upon. So stigmatization of mental illnesses is very much alive and rife across all the strata of society, and not just who we think are the less socioeconomically deprived ones. So this was broadly summarizing public stigma. The second type of stigma that I would like to talk about is basically self-stigma. Now, those suffering from a mental illness are often very shy to come out with their symptoms and seek help. And why is this the case? Because of what the world has made mental illness out to be, people are worried about how they might be perceived, and it often leads to a delay in getting treatment or never ever getting treatment at all. I mean, it's quite shameful, isn't it? This can even lead to a stage of where they can have untreated symptoms and they can become severely unwell. And what we know about mental illness is that the longer you treat mental illnesses untreated, the more difficult they are to treat. Thus, this only leads to increase in the burden of mental illness overall. Now, imagine identifying yourself as the monster which the world has made a mental illness to be. Imagine that you are the monster that people think, a person suffering with mental illnesses. It's absolutely devastating and life-changing. Imagine the amount of shame, guilt, hopelessness, and the perceived image of coming across as dangerous and incompetent it can have on your mental state. It can actually worsen whatever underlying mental illness that we might be suffering from. Your basic things like your self-esteem and confidence can take a massive hit. And then this can also impact your relationship with your loved ones. This can impede upon your performance at work, and your entire life can be quite shaken up by experiencing self-stigma of mental illness. Now, the third subtype that I want to talk about in terms of stigma is something we have all experienced, which is institutional stigma. I want to ask all of you a question, and just to make it a little bit more engaging, I'm going to turn my gallery view on, and I want people to raise their hands by raising the question with their hand, if any of you have experienced it. And I really want to see how many hands come up. Have you ever been able to take sick leave on the pretext of low mood, severe anxiety, or a relapse of your pre-existing mental condition? Have you ever been worried about being indirectly or directly fired from your job if your employer discovered that you have a mental illness? Have you ever been able to disclose in your pre-employment checklist that you have a history of mental illness? If anybody has ever done these things, please put your hand up. I'll give you 10 seconds. I don't think okay, we have one hand there. That's very encouraging to see that people have been able to do that. But as we can see, that majority of us, unfortunately, have not been able to do that. In India, there is a widespread institutional stigma about mental illnesses. And no, medical professionals are sadly not spared from this either. I remember being an intern at Aravind Hospital and seeing residents being drained after long 24 or 36-hour shifts. Some of them approached professors and consultants who just blatantly ignored the deteriorating mental health. I have seen resident doctors needing psychiatric admissions, and I have known, unfortunately, a few who have succumbed to suicide as a result of lack of consideration by institutions to their well-being and watching them being completely burned out at their job. I just want to clarify, I'm not taking the name of the particular hospital, but this is just something I have seen at one particular hospital, and I have known this to be the case for several hospitals across India as well. So how do we address stigma? This discussion probably needs much longer than the time I have remaining today, but broadly speaking, we need to shine some sunlight on conversations about mental illness, exactly like how we're doing today, thanks to Sunit and everybody else who have been involved in organizing this discussion. Simple things like educating ourselves about the facts and busting myths about mental illness is a great place to start. We have to be very conscious about the language that we use about mental illnesses, and we have to call out inequality and discrimination when we see it happening around us to the people who are suffering with a mental illness. And even though controlling public policies or making changes at a national level are not in our hands, especially for the majority of the members who are present here, there is so much we can do at personal and at community level. For example, we can take a pledge to make increased social contact with people who suffer with mental illness. This alone has been proven to improve the health of those suffering with mental illness. We can encourage people to speak about their symptoms. We can normalize conversations about mental illness. And we can also make a pledge that we have to call out people using terms like lazy or drama queen or crazy when they're referring to people with a mental illness. this is such a common thing that we see, and I'm sure, I have to admit, I might have also used this word for somebody when I was maybe a teenager, and I really regret doing this, and I feel absolutely ashamed that I did this. I think this came from a place of lack of education. And as I grew older, I realized how horrible this must have felt to the person who I even joked as, oh, you'd be crazy, stop doing this. This is absolutely horrible of me to do this. And I really wish that things like this, using sensitive language and being empathetic, can be taught to all of us at a very young age. For example, when we're in primary school or secondary school, it's actually that important. Coming to schools, I think it would be absolutely fantastic if we could develop supportive measures at academic institutions and workplace institutions for simple things like having access to in-house psychiatrists and in-house psychologists and counselors. I mean, it has taken movies like Tar is a Meme Poet to teach us that children with severe learning difficulties can also shine bright and achieve their true potential if they have access to the right kind of support. And the last thing I'd like to say is that a study by Professor Sir Thornycroft in 2016 and his colleagues have shown that alongside pharmacological, which is medicines, and psychological therapies, actually interventions to address stigma are a huge, potential, valuable, complementary tool for the recovery of those suffering with a mental illness. So talking about stigma is not just an option, it's mandatory. And thank you so much.